older people that are indoors a lot of the time aren't going to be exposed to the sun. And of course, it's the older people that have died primarily from the COVID-19 disease. And as well as that, in old people, the skin produces vitamin D more slowly. So even if old people are sunbathing, they will produce vitamin D more slowly. So they would need longer sun exposure to get the same dose. As soon as a diagnosis is confirmed, if someone's under the age of 60, they should just start taking vitamin D, 800 to 1,000 units a day. Just start taking it, regardless. Start taking it, that's what they're saying. So people with higher levels of vitamin D have lower mortalities. They're less likely to die. People with low levels of vitamin D have higher mortality. They are more likely to die. This is a correlation. And they recommend vitamin D supplement of 800 to 1,000 international units a day in people under 60 as soon as the diagnosis of COVID-19 is confirmed. And they correctly point out that vitamin D is a pro-hormone. In other words, the vitamin D that's synthesised in the skin is converted into a substance that essentially acts as an endocrine hormone. And an endocrine hormone is something that's produced in one part of the body and circulates, carrying information to other parts of the body. And we know that there are receptors for vitamin D actually in every cell of the body. So this is a very important hormone that's synthesised from this vitamin D that's a pro-hormone. So it modulates the function of the immune system by stimulating macrophages and dendritic cells. And what happens is these detect when there's an antigen present. And an antigen, of course, would be a virus or a bacterium. So that they're antigen detecting and antigen presenting cells. And these macrophages that I mentioned here, these are huge cells. And these macrophages migrate through the tissues. And when they migrate through the tissues, what they can do is they can release cytokines to control things like immune responses and antibacterial and antiviral responses. And they also engulf bacteria and viral cells and destroy them. So these are eating cells, and the eating cells are called phagocytes. So both of these cells are absolutely essential immunological cells. So for a good immune system, these need to be stimulated by this activated vitamin D. In people that get complicated COVID-19 diseases, these are the air sacs here, the alveoli. And if these are inflamed, then these can fill up with fluid, and the person can drown because the oxygen can't get out into the blood. And the carbon dioxide can't get from the blood back into the alveoli to be breathed out because of this excessive inflammatory reaction. It's a bit like when you sprain your ankle, you get fluid around your ankle, and in the same way you get fluid in your alveoli. So the role that vitamin D plays in protecting the lungs from this excessive inflammatory response has a role in the acute respiratory distress syndrome, where the alveoli fill up with fluid and is one of the causes of mortality. So if the immune cells are producing too much of these cytokines, then that's causing too much inflammation in the alveoli and in other parts of the body, this so-called cytokine storm. And that can cause this acute respiratory distress syndrome. And in acute respiratory distress syndrome, the alveoli fill up with fluid and the patient effectively drowns. So this is a very important modulating role. And they point out this is simple and it is inexpensive. And they're also recommending that rapid serum vitamin D testing in people over the age of 60 with COVID-19. So what they're saying is that if people are admitted to hospital or people are diagnosed with COVID-19 and they're over the age of 60, and I agree with this completely, in fact I would do it in younger people as well, but they're saying for people over the age of 60 who are diagnosed with COVID-19, they should have a blood test to determine their blood levels of vitamin D, to see if they are deficient in vitamin D in their blood. They should be given a loading dose of 50 to 100,000 international units, quite a high dose, if people over the age of 60 are found to be deficient. So they should be given this large loading dose. This is not me speaking, this is the French authorities. If you want to take it, contact your own doctor and get it prescribed, in case of deficiency, which could help limit the respiratory complications. So they're testing people, and if they found out to be low, then they give them a rapid boost, a big dose to boost it up and get it up quickly. And they think this is going to reduce respiratory complications. And they recommend vitamin D supplement of 800 to 1,000 international units a day in people under 60 as soon as the diagnosis of COVID-19 is confirmed. It's easy to correct, and we just don't seem to be doing it.
There are now more COVID-19 patients in the UK hospitals than there were on the day of lockdown in March.
Shirley went through it all in March and April, with the surge in patients going into intensive care. And now she feels it's happening again.
Double the number a week ago. That just shows how fast things are escalating and the impact on the hospital.
There's concern at how fast events are moving. Says they're doing what they can for all patients, but it's getting more difficult by the day.
I don't have the room to manoeuvre within the hospital that is already full. and full of really deserving patients.
A message which all NHS staff want the public to grasp as they face the bleak consequences of rising virus infections.
It's the day that as the number of new infections continues to increase, the virus is moving further into southern England and also spreading from the younger generations to older, more vulnerable people.
The Nightingale hospitals in Manchester, Sunderland and Harrogate, set up for the first wave of coronavirus, are now being mobilised for the second. There are more patients in hospital with COVID-19 than when the national lockdown happened in March. Many who were never admitted to hospital have lingering health problems like fatigue, so-called long COVID. And then there are all the usual demands on the health service. So much depends on whether the rise in coronavirus infections can be curbed. This map shows the rate of change of coronavirus in England. The areas with the sharpest rise in rates are shown in red, and you can see they're not just in the north of England. The epidemic is also growing further south. NHS leaders warn that some hospitals in northern England could be treating more COVID patients than they were in April, and they're urging the public to respect the rules on coronavirus.